Okay. So according to the questions which appeared in the previous papers, so I am actually designing my lectures according to that. So over here, today we will be discussing about the evidence-based dentistry and then its application in one of the research studies they have mentioned in one of the questions in one of those exams. What is evidence-based dentistry? Evidence-based dentistry is an approach to oral health care that integrates the best available scientific evidence with clinical expertise and patient values. The goal of the evidence-based dentistry is to improve patient outcomes by applying the most current and relevant research to clinical decision making. If we look at the key components of the evidence-based dentistry, so these are best available evidence, clinical expertise of the practitioner, then patients' values and their preferences, including their economic concerns as well. So best available evidence means this involves systematically reviewing and appraising scientific research and clinical studies to identify the most reliable and relevant findings. Then the clinical expertise, the dentist's clinical skills and experience are crucial in interpreting and applying the evidence in the context of individual patient needs and circumstances. Patient values and preferences, as I told you, even their financial or economic concerns are also addressed into these. So effective patient care requires understanding and respecting the patient's preferences, concerns, and their expectations. Of course, the expectations should be real expectations. The process of evidence-based dentistry, it is actually, first of all, you start by ask. You formulate a clear clinical question from a patient's problem. This often involves using the PICO or PICO framework. So P is for patient problem, and I is the intervention, C is the comparison, and O is the outcome. Then acquire. Conduct a thorough search for the best available evidence from reputable sources such as systematic reviews, clinical trials, and other research studies. Then you have to appraise. Critically assess the validity, impact, and applicability of the evidence. This step involves evaluating the quality of the research and the reliability of the findings. And then you have to apply it. To integrate the evidence with clinical expertise and patients' preferences to make an informed decision about the care plan. And then assess whatever you have done, what is the outcome. So you have to evaluate the outcomes of the decision and the process to improve the future clinical practice, and it is a perpetual cycle. Then whatever you find out, if there are some shortcomings or not or whatever, again, the process of asking, then acquire, appraise, apply, it will continue. Benefits of the evidence-based dentistry. Improve patient outcomes. By using the best available evidence, dentists can provide more effective and efficient treatments, then enhanced quality of care. So the evidence-based dentistry promotes standardized practices based on scientific research, reducing variations in care quality. Informed decision making. Dentists can make well-informed clinical decisions that are aligned with the latest research and best practices. Then the patient satisfaction. Involving patients in their care decisions and respecting their values and preferences can lead to higher patient satisfaction. So not only you, but you have to involve the patient as well, their values, their preferences, and of course the cost of the treatment. That is also important. Then you can make the treatment plan. You have to decide it together. Challenges in implementing the evidence-based dentistry. The accessibility of evidence. Dentists need access to up-to-date research and systematic reviews, which can sometimes be difficult to obtain. So you have to be keeping yourself abreast of the new innovations and the new publications in the field. Time constraints, because of course you have to practice, you don't have time for all the things, and you have, like, there are 24 hours in a day, so you have to be very, very, you can say in a way, uh, running to against the time, because you have to give time to your family and of course the commute time and everything that matters. So the day is of only 24 hours, and of course you have to practice as well, especially if your practice is quite busy. Skill development. Dentists may need additional training in research methods and critical appraisal skills to effectively practice the evidence-based dentistry. So apart from gaining the clinical experience and going for those courses in continuing education, which will train you in the clinical field, you should also take some courses in the research methodologies as well as into clinical appraisal skills. That critical appraisal skills. Resources for the evidence-based dentistry. Cochrane Oral Health Group. It provides systematic reviews of primary research in human healthcare and health policy. PubMed, a free search engine accessing primarily the Medline database of reference and abstracts on life sciences and biomedical topics. Then the American Dental Association Center for Evidence-Based Dentistry. It offers resources and tools to support the evidence-based dentistry in clinical practice. And finally, NIDCR. NIDCR is a branch of NIH. It conducts and funds research to improve the oral health. Critical appraisals in evidence-based dentistry. Critical appraisal is a systematic process used to assess the validity, results, and relevance of research evidence in order to apply the findings to clinical practice. In evidence-based dentistry, critical appraisal is essential for evaluating the quality and applicability of research studies to ensure that clinical decisions are based on the best available evidence. Steps in the critical appraisal. First of all, formulate the clinical question using the PICO or PICO, whatever you call it, and then search for evidence. Identify relevant studies by searching databases such as PubMed, Cochrane Library, and Area Center for Evidence-Based Dentistry. Evaluate the study design. Assess the type of study, for example, a randomized controlled trial, or maybe a cohort study, or maybe just a case control study. And then its appropriateness for answering that particular clinical question which you are looking into. Check for bias and methodological quality using tools like the Consort checklist for randomized trials or the STROBE checklist for observational studies. Assess the validity of the study, not like both the validities, internal as well as the external. So the internal validity, it determines if the study design and conduct minimize bias. Key considerations include randomization, blinding, and control of confounding variables. External validity, it evaluates the study results are generalizable, means you can apply it on your clinical procedures or not. And if somebody can, again, able to conduct the similar kind of study, would they be able to get the similar type of results? That is external validity. Analyze the results. check the statistical significance using the p-values and clinical significance, effect sizes of the study findings. Look at confidence intervals and the precision of the estimates, assess the potential for type 1 and type 2 errors. I will make a separate small lecture or maybe just a small presentation for type 1 and type 2 errors and what kind of effect they will bring. So I will provide it to you soon. Interpret the findings, summarize the main outcomes and their relevance to the clinical question, consider the consistency of the findings with other studies and systematic reviews, take into account the study's limitations and potential sources of bias. Apply the evidence to clinical practice. Integrate the appraised evidence with clinical expertise and patient preferences. Formulate a clinical recommendation based on the strength and quality of the evidence. We are discussing these steps in the critical appraisal. Tools and resources for critical appraisal. Critical appraisal skills program. It provides checklists for different types of studies to guide the appraisal process. Then grade. Grade is grading of recommendations, assessment, development, and evaluation. It offers a systematic approach to rating the quality of evidence and strength of recommendations. Then the Joanna Briggs Institute. Critical appraisal tools. A set of checklists for appraising various types of evidence. JBI. Questions to appraise an RCT. When critically appraising a randomized controlled trial, there are three essential questions that should be adequately addressed. First one is, are the results of the study they are valid? Means there is internal validity. Then what are the results? Can the results be applied to patient care or further studies? External validity. Are the results of the study valid? Means internal validity. So how we can be sure? Randomization. Was the assignment of patients to treatments randomized? Proper randomization ensures that each participant has an equal chance of being assigned to any of the intervention groups, which helps to balance known and unknown confounders across the groups. Then blinding. Were the participants, personnel, and outcome assessors blinded to the treatment assigned? Blinding minimizes the risk of bias in the measurement and reporting of outcomes. Means you are working on two different analgesics. Analgesic 1, analgesic 2. Both of them, they claim that it is good analgesic as well as it is good anti-inflammatory. It has both the qualities. So you try, you don't know the name of these. You are the personnel. You just assign them 1 or 2 or drug A and B, whatever. Then patient does not know which drug they are going to take after one of the procedures which you say. For instance, we say third molar surgery. Third molar surgery. Where bone cutting and flap procedure, soft tissue surgery was involved. Both type. And then you gave either this or this randomly, you without knowing which one is which one. And then the results which came back after, like, say, for instance, patient comes back after 5 days for the removal of stitches, and then you ask them after taking the medicine and you give them the proper instructions that before your anesthesia wears off, you take some ice cream or some cold food and then take the medicine and etc. etc. Patient comes back and you say, okay, so on the first day, on the scale of 1 to 10, how good your uh, pain control was. 1 being the worst, 10 being the best. On the second day, on the third day, on the fourth day, and so on. Similarly, those who were taking, just they were telling to the assessor that I had taken A or I had taken B, whatever. Or maybe it is not even your patient does not know which one they have taken. Only it was in their record. From there, they are assessing. So finally, we will be having the actual information that, okay, which one is a better analgesic and which one is a better anti-inflammatory. This is called blinding. Single blinding, double blinding, etc., etc. Is it clear to everyone? Okay, good. Then the follow-up. Was follow-up complete and were patients analyzed in the groups to which they are randomized? This addresses issues of attrition and ensures the integrity of the randomized groups. Then what are the results? Treatment effect. What is the magnitude of the treatment effect? This involves understanding the primary and secondary outcomes and their statistical significance. For example, the p-values and the confidence intervals. Then precision. How precise is the estimate of the treatment effect? Precision can be assessed through the width of the confidence intervals around the effect estimate. Narrow confidence intervals suggest a more precise estimate. Then can the results be applied to patient care? Means external validity, generalizability. Are these study participants similar to the patients you treat? They are representative of the population. Consider the inclusion and exclusion criteria of the study to determine if the study population is representative of your patient population. It is not that you are selecting some other kind of people which are generally not living in your area or not visiting your clinic. So it will be selection bias. Then feasibility. Is the intervention feasible in your clinical setting? Assess whether the intervention can be realistically implemented in your practice. Benefits versus risks. Do the potential benefits of the treatment outweigh the potential harms? This involves weighing the clinical significance of the treatment effect against any adverse effects or risks associated with the intervention. By addressing these 3 essential questions, clinicians can better understand the validity, results, and applicability of an RCT's randomized controlled trial, thereby making informed decisions about incorporating the evidence into their clinical practice. 5 steps in the evidence-based dentistry. Ask a clinical question, formulate a clear, focused clinical question based on patient care needs. This often uses the PICO or PICO, whatever you call it, framework to structure the question. Then acquire the evidence, then appraise the evidence, apply the evidence, then assess the outcome. This is the PICO or PICO format. Identifying the problem of the disease of interest in a patient. So patient, population, or problem. Then the intervention or treatment in the question. Then the comparison treatment, usually the alternative treatment. And finally, the outcome. So the example from our examination paper, a 3-year randomized controlled trial to determine the effectiveness of 38% silver diamine fluoride in the arrest of root caries with 0.2% chlorhexidine gluconate in older adults. So what is P? Older adults with root caries. Then intervention, 38% silver diamine fluoride. And what is the comparison for that? We have 0.2% chlorhexidine gluconate. So the outcome, effectiveness of whatever the two in the arrest of root caries. If we look at this PICO or PICO breakdown, population, the study focuses on older adults who have root caries. Intervention, the main intervention being tested in the application of 38% silver diamine fluoride. Comparison, the comparison is made against the use of 0.2% chlorhexidine gluconate, and outcome, the effectiveness of the intervention in arresting the root caries. So this PICO or PICO framework helps in clearly defining the clinical question and guiding the search for relevant evidence to support the clinical decision making. So over here, we are done with this lecture.